Atrial fibrillation is the most common type of heart arrhythmia affecting millions here in the U.S. Those diagnosed with AFib may be prescribed blood-thinning medications to reduce their risk of stroke. A new survey reveals that many people on these medications don't know there's a treatment that reverses these blood thinners if that's needed in an emergency. So here to tell us more is RN and CEO of Healthy Women, Beth Battolino, and Dr. Nisa Goldberg, who's a cardiologist and medical director of New York University Center for Women's Health. Good morning, ladies. Lovely to have you here. It's life-saving information. Why is blood thinning treatment important for patients with AFib?
AFib, also known as atrial fibrillation, is an arrhythmia that increases risk for stroke. The blood thinners reduce blood clotting and risk for stroke in people with atrial fibrillation.
So then, when might a blood thinning medication need to be reversed?
Well, if someone has an emergency or has a lot of bleeding due to a cut that they may have had in the kitchen, because sometimes you're not paying attention to what you're cutting and you accidentally cut yourself, and people on blood thinners have increased bleeding. A car accident, you fall and hit your head, slip down the stairs. Those may be situations where the blood thinner has to be reversed so that we can stop the bleeding.
So what should a patient do if they begin to bleed or if there is an emergency situation?
They need to call 911 and go to the hospital.
How do these reversal treatments really work?
Well, blood thinners work by decreasing blood clotting, and reversal agents promote blood clotting. And we use the reversal agents to basically stop the bleeding in these emergencies.
And doctor, it would be very important that if you were to call 911, you have a bleeding situation, to let those first responders know that you have AFib and you have treatment for that, and that's why you're concerned, because you're on blood thinners.
That's right, and Beth has some tips on what you should do.
Right.
Okay, Beth.
So if you are in that emergency situation, please definitely let those people around you know that you are in a blood thinner, because it's so important for them to flag you. And if you are a candidate for that reversible agent, they can give it to you. We're very, very lucky with technology today that many of the hospitals are connected to the electronic health record system, so they can flag you if you don't have that medication card or someone with you. They can pull up your record and say, oh, Beth is on a blood thinning medication, and we do have that reversible agent, and she is a candidate for it, and so they could give it to me, and it could potentially save my life. It's also really important, if you are on a blood thinner, to understand there's certain things in your activities of daily living that you can start practicing, such as if you're shaving and you're using a regular razor, think about changing to electric razor. This goes for you too, ladies. It's great to shave your legs. Soft bristle toothbrush and flossing. Use the wax-covered floss versus just the regular floss. It could help prevent that the bleeding, which we're all so concerned about. So for more information, log on to healthywomen.org for information and resources on AFib, and more importantly, questions that you can have with your healthcare professional on reversible agents.
Thank you, ladies. Such good information, such life-saving information today for people who have AFib. Thank you very much.